Hello, FASTrack parents and guardians. My name is Gray Flora. I'm a senior academic mentor in FASTrack, and I'm so excited to be doing the first parent and guardian Q&A video of the semester. And I'll get right into it. Today we have Mr. Alex Langhart, who is the director of the Student Health Center here on campus at the University of Mississippi. Alex, thank you for being with us.
I'm so happy to be here. Also honored that I get to be your first video. So thank you.
Yeah. The first video that's actually recording on campus. Last year, I did all of these from my bedroom / office, which was a card table and a folding chair. So it's nice to be back on campus. And speaking of being back on campus, for our parents and guardians, first of all, I know that you all have had just an unbelievably taxing year as you've cared for your young person while they, sorry, I'm getting a little bit of echo here, cared for your young person while they tried to navigate online hybrid distance learning that kind of unfortunately put a cloud over into their junior year and their senior year if they are coming straight from high school. And I can imagine how difficult that's been. And it's obviously been very difficult for us here at the University of Mississippi, because one of the hallmarks of this community is that we are relational people. We want to care for each other. We want to do things, we want to do things together. We want to be intentional about building community and strengthening and existing within community. And so it was difficult for us to be so online and hybrid last year. That's not the way it's supposed to be. But I do know that it's we are slowly coming back out of that. And I thought that it would be great to bring Alex on today just to kind of talk about the realities that COVID is still very much among us. And here in Mississippi, especially, unfortunately, with the Delta variant. And, there's a lot of misconceptions or just a lot of confusion about, okay, what is the University of Mississippi doing? What is my child supposed to or not supposed to be doing? Questions about vaccinations. So I thought this would be a good place for us to start to hopefully clear the air on a lot of those things. So Alex, what are the face mask protocols on campus?
Yeah, great question. Right now, the current mask protocol on campus is any indoor space, masks are required. So,
what about being in my office by myself?
No, not in your office by yourself.
Okay, good. So I'm good right now. Okay.
Yes.
I've got one, but Okay.
Yeah. And that was following the recent recommendations and directives from the Mississippi State Department of Health. With the recent spike in the Delta variant in Mississippi, it's been quite the strain on our hospital system as a whole. And we've even been feeling it here in tiny Oxford at our local hospital. So everything that we can do to take the strain off that and keep our campus safe is what we want to do. Okay.
So any indoor space, students need to be wearing a mask correctly, which is over their nose and mouth. Outside?
No, it's not recommended outside. We know that there really hasn't been that much transmission in the outdoor area, as long as there's been significant spacing. So you'll still see recommendations if you're outdoors and in a tightly packed area, such as maybe outdoor restaurant or something else like that, where you're right on top of each other. It still might be a good idea if you don't know the vaccine status of everyone there. To mask up, but we've had baseball games over the past year. We've had events out here on campus, and we really haven't seen anything so far that we can tie back to transmission being held from outdoor gatherings and events.
Okay, that's good to know. Are the mask mandates that we have on campus different than the city of Oxford, or are they the same?
I think they're the same, because I believe the city just recently came out for indoor spaces as well. And they, of course, recommend it whenever you can, social distance. So, yeah, we're pretty much in line with that even though ours went into effect first because of the MSDH ruling.
Okay. And so I'm going to ask a question that I don't know that you're going to be able to answer definitively, but I do think it's something that I've gotten a lot of feedback. It's on the minds of parents and guardians. When will the mask mandate end?
That's a great question. And so, unfortunately, a lot of that depends on what's going on in our community. And that's something that we're monitoring really every day. I know the chancellor's looking at it, upper administration's looking at it. So when we start to see, obviously right now, if you look at a graph of the state of Mississippi and then also even in Lafayette, it's a very steep incline of cases and then hospitalizations. So when we start to see those tip over to the other side and start coming down, that's when we will make sure that the environment allows for us to take off the mask again. Because I mean that's right. We want to get back to normal, kind of how it really was, for us. So that's definitely where we want to get to.
Sure. Okay. Well, a lot of folks have been telling me that I would really look great in a mask, and I may need to keep one on afterwards. So I'm just going to kind of get used to it. Okay. So kind of another question in that same vein, can students, if they are not already vaccinated, can a student get vaccinated on campus?
Oh, yes, very easily too. So not only do we have our larger vaccine clinic that we hold every week at the Johnson Commons, and there's actually
I'm going to stop you for a second. The Johnson Commons Rebel Market, that's like the main cafeteria on campus, parents and guardians. So your kids are know where that is. Anyway, sorry.
Yes, yeah, great point. So that's every week that we're doing. And then also at any time, and those are no appointments either. You just walk in and you can get the Pfizer vaccine, or you can come to Student Health Pharmacy any day of the week between 8:30 or 8 and 4:30, I believe. And get
8 a.m., 4:30 p.m.
Yep.
Weekends or just Monday through Friday?
Just Monday through Friday right now. Okay. And you still have various options in town for vaccines. I mean, you got pharmacies giving them, you got other clinics giving them, you got the drive-through sites. So there's still a lot of availability.
Excellent. And I know that I've walked several students already over to the student health clinic, which again, if those of you that maybe are not as familiar with campus, where we're talking to Alex from, that student health center is kind of adjacent and catty-cornered from Burns Hall. And it's just up the hill from Martin, Stockard, from Stewart, all those places. It's a very centrally located place. And like I said, I've gone with students to get their vaccine, and it's a very quick process in and out. Was not a lot of hassle at all, very minimum paperwork, et cetera. Well, that's good to know that we've got, very convenient locations for that. What would you say as someone who's been very much in the throes of the COVID-19 pandemic in terms of administration and in terms of just kind of like being very immersed in this? Some of us maybe tried to get away from times from COVID, from reading the data, the news, but that was obviously part of your job, something you couldn't really ever get away from. What would you tell someone maybe that's a little hesitant about their child specifically getting the vaccine? They're 17, 18, 19-year-old that's here on campus that maybe is hesitant about getting the vaccine.
Sure. And of course, I want to preface this with saying that all those conversations need to be had at that level and with your personal care provider, whether that's a physician, nurse practitioner, whoever that you trust in the medical field, to have those discussions, because not everyone can get the vaccine, whether it's for certain allergies or certain other reasons that they can't. The data showed that it's very safe and effective, especially for that age group that's there. That's it's already low risk of getting severe outcomes from COVID. But what we're seeing though is that those that don't get the vaccine, students can still get, there's been long haulers at that age that they can, even though they might not have a severe outcome while they have COVID, there could be lingering effects afterwards that could, prohibit you from having your normal everyday life. Also, I think, that we've seen that the vaccines are so effective that the best way to get out of this kind of cycle of these spikes in cases and these hospitalizations. And, a lot of it is, if you're not going to do it for yourself, do it for others, do it for that other immunocompromised person, do it for that person that are in those age range that have severe outcomes and are being hospitalized. Because you can look at the data right now, especially Mississippi. I mean, 90% and higher are unvaccinated that are in the hospital right now.
Right. Gotcha. Yeah. And I imagine, from my own amateur data evaluation, those that are vaccinated that are in the hospital are older, more vulnerable populations. And so they're getting the breakthrough. And a lot of times that's coming from people that aren't vaccinated that are spreading it. Right. And so it's really, that's really good information. Thank you for that. So, we've established, that it's important to get the vaccine in terms of for just the community health, and also that it's very easy to get on campus. And I also want to, we've talked about masks, but I also want to talk about the policy for our campus as it pertains to what happens if being a college student, what happens if I get COVID? What should I do? I might be coming down with COVID. I'm experiencing some of those symptoms, right?
Yeah. So there's actually a lot that goes into that. So I'm glad it's a great question. We get a lot of questions about that too. So
thank you. I'm flattered that you think it's a great question. Pride myself on that.
Yeah. So the Delta variant's been so different because it had kind of the common symptoms that the original wild type had. So most people now are coming in with just stuffy noses or runny noses, congestion, light cough. We haven't really seen as much of the loss of taste or smell, which is such a unique symptom that you knew, had COVID, back then. Mm-hmm. So any type of waking up, feeling bad, feeling sick like you normally would probably during this season, and especially coming to college, being around,
sure.
You definitely need to seek out a healthcare provider. And of course, student health is right here on campus, very easy to access. You can call, make an appointment, you can walk in, and what we'll do is we'll go through that assessment. So we'll see, we'll find out whether you've been vaccinated or not. We'll find out what your specific symptoms are. Have you been exposed or around anyone that, there might be a risk for that? And then the test is easy. It's not this scary, 12-inch swab that they shove up and tickle your brain anymore. Mm-hmm. Do a lot of the mid-air, which is right in the nostril, like you would do for a flu test. And
so there's a lot more. There's a lot of other much more scary tests going on campus, right?
Yeah, absolutely. It's not invasive. It's probably a minor inconvenience, and you might make your eyes water a little bit, but it's not bad. And when we have the availability, depends on the supply. We have rapid PCR tests that we do here. So you get results back in 30 minutes. But when we don't have those, we have to send it out like most clinics do. And those results come back usually within 24 or a little less than 48 hours. And so what's important during that time is that if you're symptomatic, is that while you're waiting for your results, you need to kind of isolate yourself away from others until you know your result. And of course, if it's positive, you'll be notified. And I'll actually, if you want me to, Gray, I'll walk through that whole process.
Yes, please. What if I'm positive?
Yes. But if you're negative, you're going to get a phone call. I guess is what I'm saying. You will be notified from our clinic or any other clinic in town who's waiting on your results. So if you are positive and you happen to live on campus, there are a couple things that happen. So of course, you'll be notified of that by our office, and we will walk you through everything that you need to know of whether any over-the-counter medications that we can provide, whether you meet the criteria for monoclonal antibody treatment. We can discuss in a little bit. And so we'll give you all that piece of it from our perspective. From there, housing will then kick in, and there should be a CA or someone from housing that will then will be notified usually by the student, letting them know that they've tested positive. And then they will start that process of, okay, what do I need to do for isolation? Because as you know, we do have an isolation residence hall here, Brown Hall, on campus that is available. That is what the family decides is best for that student. And some make that choice because some are 12 hours away or very far away. And others are able to go home and isolate there. So there are options. And in a lot of resources.
But staying in the dorm is not an option.
No, see, and the reason for that is that when you're a positive case and you're actively infectious, you have, the point of isolation is to get you away from others so that you don't potentially spread it. And a lot of halls here on campus are still traditional and have a lot of communal areas. And so we want to make sure that we isolate that student away.
Got it.
So again, they'll get a lot of information from housing on what kind of a checklist, what they can bring, what they need to bring, what resources they have, how to get food, what amenities are already over there for them, who can check in on them. Because Student Affairs through Dean Marsh actually has a nice little program where you can fill out a form and the student can indicate how often they would like to be contacted by someone from Student Affairs. And our students, we have a nurse practitioner here who will call in and check on the student for any other health needs that they may need. Because remember, they're going to isolate for 10 days now. It's not before.
Okay. 10.
That's right.
Got it. So regardless of my level of symptoms, as long as it doesn't, reach the point of a need for outside medical care, 10-day isolation is what I could count on probably if I have COVID.
Oh, definitely. It's a virus, so you have to treat the symptoms. Unfortunately, there's nothing that you can take. Obviously, antibiotics won't work against that. So, we treat the symptoms, make you as comfortable as possible. But if you do have some of the warning signs, maybe shortness of breath, you have bluish lips or type of labored breathing, or a very high spike in fever, then that's when we would need to, get you to the hospital here. And Baptist also has a 24-hour call line just for COVID patients. So we give that information out to our students as well. And then, of course, they have 24-hour on-call people in housing too, if they needed to make that connection in order to help a student get transported.
Gotcha. Fantastic. And so, so whether I'm vaccinated or not, if I have the Delta variant, even if my symptoms are mild, I'm still looking at 10 days in isolation, whether that's going to be off campus or in the designated COVID quarantine dorm, which is Brown Hall, correct?
That's correct.
Okay.
And you're not going to be, unless you're an exposure, and there's some different criteria for that.
We'll get there. But
if you're symptomatic, yes, you're probably, if you have any of the symptoms of COVID, you will be tested for that. And if you end up testing positive, whether vaccinated or not, you will have to isolate because there have breakthrough cases. Now, from what we observed, the breakthrough cases have been very mild. They've been, they've been sick, but not to the point that they would need any type of higher level of care.
Something that in a pre-COVID world would never be a cause for alarm at all.
Right.
Yeah. Okay. Well, here, this gets a little more complicated. Could you please talk about the difference, or first of all, kind of maybe, if you could, as best you can, define what an exposure is classified, like how the University of Mississippi, what University of Mississippi considers an exposure. And then maybe talk about, if you could, the differences between what's required of someone who is who is designated an exposure if that person is vaccinated versus if that person is unvaccinated. Does that make sense?
Yeah, absolutely. So we're going by what the CDC and MSDH definition of a close contact is, or an exposure. You'll hear those terms interchangeably. So a close contact, or one who has been exposed, is someone that has been around a confirmed positive COVID patient for more than 15 cumulative minutes within a distance less than 6 feet. Okay, so that it used to be a 15 minutes consecutive. Now it's kind of, if you have repeated exposure over a day around someone that's positive, that adds up to 15.
Okay, so like if I was in the class with someone, we were all wearing our mask, which was required, I'm not exposed, technically.
No, well, the contact tracing team that we have would dive into that to see, but the protocol we have right now in place with masking and the way the classrooms are set up, it would be a very low level of risk. However, we would investigate all those cases like we do and see if there would be a need to quarantine. But we want to have the least amount of disruption for students in the classrooms possible. So that's why we have these other protocols and this layered approach in place.
Gotcha. Okay, so what about, so if I am deemed an exposure and I am and I'm unvaccinated, what is let's say I'm feeling those symptoms, or even I test negative for COVID-19, what is required of me because I have been designated an exposure?
Yes. So if you're unvaccinated and are exposed, then that means that you will need to quarantine. Okay. And for 10 days. However,
10 days.
However, the Mississippi State Department of Health does have options to where you can actually test out of quarantine early, but you have to meet certain criteria, right? So you have to get a PCR test by no earlier than the 5th day of your exposure. Okay. Into a little example here because this is where it gets a little tricky.
Okay.
So, on that 5th day, you can be tested, and then if your PCR test comes back as negative, then you can leave after the 7th day. So you only have to quarantine for 7 full days instead of 10. But you also have to be asymptomatic that entire time. You can't have any symptoms. So what we've come across are, that you learn, let's say you learn that you're exposed. What most people's reaction is immediately is, I got to go get tested. Well, that's true if you feel that you have symptoms, but how quarantine works, what you would want to do is you would want to determine when your last day of exposure was around that person. Then you would want to count out the 5th day from that day so that you can go test it on that day and then get out of quarantine by the 7th, after the 7th. And so that's how you would calculate.
Okay, that makes sense. Okay, now are there different protocols for being an exposure if I am fully vaccinated?
Yes, as of right now, if you are fully vaccinated and are deemed an exposure, you do not have to quarantine.
That's good.
Well, that's a great incentive to get vaccinated so that you won't have to miss class or any other activity or anything like that. As long as asymptomatic.
Sure.
Now, I will note, though, that the CDC does recommend that even vaccinated and exposed, that they recommend still getting tested within 3 to 5 days, just to make sure. But as long as you remain asymptomatic, you're fine. So a lot of students have been able to take advantage of that when now that they have been vaccinated, so they don't have to quarantine for any time.
Absolutely. Okay. Well, that's really good to know. Good to know some of those differences. Parents and guardians, I hope that's helpful in terms of understanding kind of like how we are dealing with the COVID-19 pandemic and the Delta variant here this fall. Alex, I can't thank you enough for your time. Are there any other things that you think would be important for parents and guardians of first-year students here at the university to know?
Well, I'm just going to shamelessly plug the health center.
Please, there's no shame.
That's what we're here for. You actually be shocked at how many people don't even know we're here or where we're located and how easily accessible we are. One of the things I always tell parents when discussing about our services is that, remember, we have no office visit fee. So when you go to any other clinic in town, you're going to have to pay a copay to be seen. Whereas the office visit to actually talk to a provider, there is no charge. So you can actually come into our clinic, talk to a physician, not have any lab or test ordered, and leave without any charge. So the only bill that you would get is if we did any labs, x-rays, supplies, anything like that. But we're going to file insurance first, and then anything left over will go to the bursar. And then, of course, we don't turn anyone away. They don't have insurance or they don't have the in-network insurance that we have. So we'll see everyone. And some other perks of that are on-site x-ray, on-site lab, and then we have physical therapy, we have nutrition services, we have a psychiatrist. I mean, we're really a one-stop shop, and we do it all. So I also remind everyone that, besides just being an acute care and seeing sickness and illness, we also do preventive visits. So, most all insurances, if you're in network, they'll pay 100% of those visits. And that's the visits we really want to promote to make sure that we keep you from getting ill or having any other, chronic problems down the road.
Gotcha. Yeah, that's great to know. And I'll put in the comment section or the description of this video a link to the Student Health Center and anything else that, if Alex, if you want to send me offline that you think would be helpful to link out. I guess I'm going to ask the question too that's on everyone's mind watching this video, and watching me, particularly the host. Do you guys cure male baldness here in the country?
I don't know. You could talk to maybe Dr. Spears about that. He might could help you out in employee health.
Okay, the search continues. Well, Alex, thank you so much for your time. And I'll, just very grateful. And we really appreciate it. I'm going to stay on here for a little while and answer some parent questions that have come in via email. But thank you so much.
Yeah, thank you all so much. Really appreciate it, Gray. And thank you, parents and students out there. I know it's hard, but we appreciate your patience and working with us. And we're here to serve you. Call us anytime.
All right. Thanks so much.
Thank you.
Okay. So that was Alex Langhart from the University Student University Student Health Center. Also provides healthcare services to faculty and staff as well. I'm very grateful for them. And yeah, I hope that was helpful. I hope that kind of gives, I know that there's a lot of misconceptions out there about the rules and procedures as far as COVID here on campus. But now you all have heard from the person that is in the room for every single policy decision and is intimately involved in that, and that's the director of the health center. One thing that we didn't touch on, but I did want to go ahead and demystify, if I could. Demystify may not be the right word, but there's been some rumblings about, the university is about to start requiring vaccines for all students. It is true that the faculty senate, which is the body made up of faculty members on campus, and they meet regularly and they vote on very important policy and procedural things related to our university. They did vote that was what they recommended the university do. However, that vote does not activate any kind of policy in and of itself. So as of right now, there is not a requirement for members of our community to be vaccinated for COVID-19. But a couple of things I will say about that again, just as Mr. Langhart said, not only has this been something that, we all are existing in the world. We know that this has been the most studied, observed vaccination trial, et cetera, that we've ever had. And it's also had the most robust participation, and the effects have not been something that has caused a pullback in any way. If anything, it's been a moving forward. We're also seeing, fatal results of the Delta variant, unfortunately. And those all things are true. But I think it's also important what he talked about today is that if we want to think about it, if we want to think about it in terms of public health, in terms of our own students' health, I do think it's really important to remember that the protocols that he went over are the COVID protocols that are at the university. So that means we're not, whereas last year in fall 2020, pre-vaccine, except wide availability, if students were in quarantine for COVID-19, every faculty member and every class they were in was compelled to be able to provide classroom services to them, just as if they were still in class. And so that meant, for instance, like I teach here on campus, and I did my lectures in person with masks, and then I would go and do them just like I'm doing this video. I'd record them because there were so many students in quarantine because they were exposed or in close contact, or they themselves were positive. And the reality is, as Alex pointed out, now that the vaccine is available, unless a student contracts full-blown COVID-19 or is exposed and has true symptoms associated with it, a student does not have to quarantine. So if a student's unvaccinated and they get exposed to COVID-19, they have to quarantine for 10 days. And they're not going to be accommodated in the same way they were before the vaccine. That's just the reality of the situation. They're going to have to be more responsible for making up work, but also trying to figure out a way to make up for the learning time they lost in the classroom, because that's where it's taking place now. In all of our classrooms, we are here on campus doing the work of educating students on campus in the classroom. And by being unvaccinated, it's a very big risk that, we don't have to even talk about the health benefits, but it's a very big risk in terms of losing a big chunk of their first semester, their freshman year, that they would have to be quarantined, even if they don't have any symptoms, for 10 days. So again, the vaccines are really easily available here on campus, and I really encourage you to encourage your students, if they are not vaccinated, to make that happen. And I'm happy to facilitate that if I can be helpful in any way. So I want to get into some other questions. You guys asked great questions just about adjusting to the university and about what FASTrack offers. I had several questions about tutoring. So FASTrack as a program this year does not offer any tutoring that is exclusive to the FASTrack program. However, there are many excellent tutoring options that I'm going to link in the description under this video that your students can take advantage of. The two I want to plug the most are the math tutoring in the J.D. Williams Library, the primary library on this campus. On the first floor from 9 to 5, Monday through Friday, there are literally stations set up with little desks and little signs that say math tutoring. And there are tutors there waiting, and your student can literally walk up and get tutored anytime while they're there. They don't have to make an appointment. There's no charge. They can go and get their tutoring done and get tutored on whatever they're having a question in any math course. I really recommend to my students that I meet with one-on-one or that I teach to, especially if they're struggling math, but even if they're not, to make sure and make a habit of at least going by once a week and just kind of working some homework problems alongside a tutor, just to check and make sure you're doing things correctly, obviously, but also in the most efficient manner. and this is a free service. There is, and these people that are tutoring are happy to do the work, happy to work with your student. And so it's a really great situation. Again, that's in the right smack dab in the middle of campus in the J.D. Williams Library on the first floor. And I'll put a link about that in the description comments of this video. Also, the second big plug I want to do is for the Writing Center on campus, the Writing Center. That is a place in Lamar Hall, which is the same place where all of your students are taking Writing 101. The Writing Center is a fabulous resource that offers walk-in and by appointment sessions where a student can literally bring in a writing project for help from one of the Writing Center affiliates, and a tutor, for lack of a better term. They could bring in their writing project any point in the process. A student could literally come in and say, I've got this paper due next week. This is the prompt. I'm really having trouble even coming up with an outline. And they can get help with that outline. And then they can start writing, and maybe they say, well, I'm having trouble organizing my ideas and different thoughts, and they can get help. They can go back and get help within, and then maybe they keep writing the paper and they want help with just like proofreading and grammar and style. They can go back again. You can go 4 or 5 times for the same paper if you go ahead and get out in front of it. And these people are delighted to help you. And again, it's another free service where you can make appointments, or you can also do walk-in hours, and it's right outside of your writing class, literally in the same building. So it's a really fantastic resource that I would highly recommend your student using. And that's one of the things about college, and one of the things that I think is prudent for students to do in their first semester is that reality is, with tests or exams, or quizzes, you have to go in there and you have to take it, and you have to perform in that moment. But with a paper, which a lot of these large classes, whether it be psychology, history, obviously writing, and then the EDHE as well, papers are big parts of the grades. And the paper you can get started on and revise and get as much help with as you want before you turn it in, as opposed to having to perform that day with the test. So those are 2 plugs, and I'll put other ones in there in our notes. But I want to really plug the Writing Center and the math tutoring. Another question some parents and guardians have asked, who is my child's mentor? So your child's academic mentor is a member of our staff that is responsible for kind of shepherding, for lack of a better term, and overseeing and serving as a resource for the cohort in your student is in. So your student is taking Writing 101, EDHE 105 in the same cohort. And we have all the different cohorts that comprise FASTrack of about 300 students divided amongst our staff members. So many students are taught EDHE 105 by their academic mentor, but we also have many sections that are taught by our wonderful adjunct faculty. But those students still know who their academic mentor is because they've received emails from them, or they've come by their writing class. Like I know for all the students, I teach 2 sections of EDHE 105, and then I have 3 other cohorts that I mentor. I've gone to all the Writing 101 classes for those sections, and introduced myself, given them my number, my email address, and I've started meeting with a lot of them. It's been really great. And so if your child's ever confused about who their academic mentor is, they can always ask their EDHE 105 instructor, or you can send me an email and I'll let you know. gray@olemiss.edu. Happy to do that. Moving right along. So a couple of you asked about just kind of the advantages of FASTrack and kind of what is its function within the university. And the way I would answer that is, first and foremost, is that this is a large public flagship university. It's a big campus. It's not a huge campus, which is a part of maybe why some of you, especially out of state, chose it, because it does have a wonderful kind of homey feeling. but it is a large public research university. And that can be intimidating. And so our goal in FASTrack is to try to make this big university feel small. And the main way we do that is through cohorting your student in 2 classes that they need to take that will be beneficial to them regardless of their major and will count towards their degree. That's EDHE 105, the freshman year experience, and writing 101. So we make sure not only do we have wonderful people, in our program and adjuncts that are teaching the EDHE 105 sections that are, exclusively focused with helping your child make a smooth transition from high school to college. We also have writing 101 instructors in the university in Oxford, dating back to the legacy of William Faulkner, arguably America's greatest writer. This is very much a vibrant literary community that attracts a lot of great writers, scholars, and thinkers. And so naturally, we have a lot of really talented world-class educators that want to teach in our writing program. And of that, and in that group, we try to make sure and handpick the best to teach writing 101. Now, that doesn't mean we don't always, that everything's always perfect all the time. Obviously, we always have to refine and make sure that we're delivering our best product to your students. But those 2 classes we feel are really foundational to starting off well at the University of Mississippi. And the reason we kind of think of it as trying to make a big university feel smaller is because your student is taking EDHE 105 and writing 101 in a cohort of about at most 20 students, but usually 18 or 19 students. The same 18 or 19 students take writing 101 Monday, Wednesday, Friday, and EDHE 105 Tuesday, Thursday together, just them and the professor. So they really already 3 weeks into the semester, your child's getting to know getting to know these group of people, and they see them every day. Now they still have other classes that are in general education classes, but they have this, this group that kind of they can study with. It just kind of is accountable. It's important to, if I'm not showing up to class, they can say, well, there's a group of, 18 people saying, where's Gray? He hasn't been here in a few days. Let's check on him. It's just kind of building a bond and a camaraderie as you start college together. And you're in these 2 small classes with professors and instructors that are really caring and dedicated to helping you adjust and learn. So those are the main benefits. And then as well as the mentoring and the academic advising, which myself and primarily Ms. Brandy Bradley do, is helping students make sure that they take courses that will go towards the major they're interested in their freshman year, while also being a part of a smaller cohort and being able to getting help navigating those things. And the academic mentors, as we talked about how those are determined, look, we're just here to be the person for your student on campus. Now, what that means is the student may have questions just about getting organized. They may have questions about navigating a relationship with the professor, or how to talk to the professor in their office hours, or how to organize their study time, or just how to get laundry, or how to do their, how to get their, where do they get their laundry done, other resources that they need help with on campus, facilitating getting to Memphis for a flight, just soft skills, general things. We are here to be that person on campus that they can ask those questions to. We don't have all the answers, but we can help them find all the answers. We can point them in the right direction for that. And that's what a mentor does. So yeah, it is a first-year learning community that's goal is to help make this transition to high school successful, transition to college successful for your student. Okay, a lot of questions about navigating Blackboard. It is natural for maybe some students to feel a little overwhelmed and kind of digitally fatigued, if you will, considering the pandemic, when it comes to navigating online resources. Many of your students have Blackboard, which is an online portal that they sign in using their Ole Miss web credentials. And it has a lot of assignments and places to turn in assignments, and a lot of readings. and as well as the syllabus for a lot of your classes, for a lot of your students' classes. If they're ever having trouble navigating Blackboard, they can always come by our office, George Hall, during business hours, Monday through Friday, and meet with their mentor or anyone else on staff, and we'll help you try to figure out and answer specific questions about navigating Blackboard. But there's one thing that I want to make sure that I clear up, that you understand, and you're also able to communicate this to your student. Blackboard is a tool that is available to all those that teach at the University of Mississippi. However, there are absolutely zero requirements for how a instructor or professor uses Blackboard. And there's also no, there's no requirement that they use it at all. So a lot of times we'll have a student that maybe thinks, oh, well, I don't have any grades, or I don't have any assignments because none of them are on Blackboard. Or maybe they use the Blackboard calendar and say, that's how I'm going to keep up with that's how I'm going to manage my time, is just use the Blackboard calendar. It is not that simple. Now, personally in my class, I try to use Blackboard for everything. And I try to update it meticulously all the time. But there are plenty of instructors, plenty of professors, and plenty of other disciplines that are not keeping Blackboard up to date, or maybe don't even have a presence on there at all. So the only way for your student to really manage their time and to really be on top of their grades in their class is to follow the syllabus. I tell my students, I sometimes pet a visual representation of syllabus and say, the syllabus is precious. The syllabus is what students need to follow. That's how if they have a planner, I really recommend that, or they recommend downloading the Google Calendar app and syncing it with their Ole Miss account and typing in every due date and every activity in each of their syllabi. I recommend putting in there so it'll always be on their phone. The syllabus is what they need to go by, not by Blackboard. But obviously, when a professor or an instructor assigns something in Blackboard, they need to do it right away, and they're responsible for checking it in that class, but it cannot be the end all be all for them. The syllabus is that for each class. Okay, we've got just a little more time left. And one of the last things people have asked is, how do I see my child's grades? So that is kind of complicated. So professors, again, usually will turn in assignments after they've been graded, either in person or via Blackboard or via email sometimes. However, the timeline for when those grades are turned in, unfortunately, is not something that is regimented. I say unfortunately, but I mean, it is what it is. It's not regimented by any one governing body, if you will. They're only required to submit final grades. So if your student's wondering where they stand in a class, the best thing they can do, and I recommend this even if they're not wondering where they stand in the class, is to go to the professor's office hours. And if the professor's office hours conflict with another class for your student, I recommend sending that professor an email, which can be found, their email can be found on the syllabus, and explaining that there's a conflict and seeing if you can find another time to meet. So talking to the professor about where you stand in the class is the best way to do that, or a teacher's assistant. And as far as being able to see grades in my Ole Miss, those are only updated at the end of the semester. And that's up to your student whether or not they want to provide you access to those grades via FERPA laws. So this was our first video today. I hope that it was somewhere between drinking from a fire hose and being really informative, because I know we covered a lot, but I hope it was all good stuff that's helping answering your questions and also helping you encourage your student. We're coming up, believe it or not. Midterms will be here before we know it. It's really important that your student develops good habits now in terms of time management, and in terms of developing relationships with professors and advocating for themselves, and seeking the resources that we have here in FASTrack, which is our people, which is our mentors. So please, my email is gray@olemiss.edu. If you have any questions about anything, please let me know and I will get back to you as soon as humanly possible. We don't take lightly that you guys have, as parents and guardians, are sending off someone you love to this university. And we're wanting desperately to be a part of helping them adjust in any way we can. So please send me emails anytime and we'll set up times to talk, etc. I'm happy to be helpful to you in any way I can. And I can't thank you enough for your child being a part of our community here at the University of Mississippi. And we'll talk again soon. Thanks so much.